For years, lawmakers have battled over medical cannabis here in Tennessee. As News Channel 5's Kyle Horan shows us, there's a commission working on how to finally make medical cannabis a reality.
Marijuana cannabis is the #1 drug that we see, with the exception of alcohol and driving related cases.
The road to legal medical cannabis has proven complicated in Tennessee.
For cannabis, it's very different.
Over the past 5 years, time and again, legislation has failed in committees at the state level.
And then people tend to use marijuana differently.
The Medical Cannabis Commission was created to study the issue and give recommendations to the state legislature.
It's very unpredictable.
Friday morning, they heard from the State Highway Patrol and the TBI Crime Lab.
You can take prescription drugs, things like Xanax, things like Valium, that may not be consistent with driving a motor vehicle. You can take over-the-counter drugs, things like Benadryl, and may not be safe to operate a motor vehicle. And the same falls true for cannabis.
Law enforcement often points to places like Colorado to show the impact of legalization. For example, DUIs related to marijuana have gone up since the state legalized recreational cannabis in 2012.
It's just a question of when they took it.
But that's a complicated issue. At the same time, the state has increased the number of law enforcement officers trained to identify such crime.
Or how they're processing that sample or where they are in that phase.
And since legalization, the number of marijuana-related arrests has gone down 70%, which isn't surprising. New laws for medical cannabis legalization have been growing at a quick pace. Colorado had medical cannabis all the way back in 2000. Then, in 2012, you can see the progression of other states joining in, plus Colorado and Washington legalizing recreational. Then, in 2020, most states have medical cannabis legalized, and all states but 2 have CBD oil.
They need to properly evaluate the risks.
The issue in Tennessee is continually advocated by residents who want treatment, including David Harrison of Safe Access Tennessee.
It is not possible to put that genie back in the bottle with respect to the widespread availability of cannabis, either as a medicine or as a recreational drug. And we need to find a graceful way for law enforcement to exit that and for us to protect the patients in Tennessee, which is what we should have been doing all along.
The Medical Cannabis Commission talks included how to get patients who want to try the drug a way to get it from nearby states who have already legalized it. They'll make a recommendation to the state, but with so much effort already made in the past, it's unclear what will happen.
The issue really here is to prioritize the patient needs.
Kyle Horan, News Channel 5.
The Medical Cannabis Commission will try to make their recommendation at their next meeting on the 17th.